wound any sun can kill.
Get a chance to stay informed. All this in the newly revamped Youth Cafe. This and every Saturday from 10 till 11 a.m. exclusively on KTN News.
Story.
A standoff pitting private hospitals and the National Health Insurer NHIF as private hospitals threaten to stop offering services to NHIF members from the 1st of February, which is just about 4 days from now. The teams have been holed up in meetings all day. They'll be giving you more details shortly on this standoff, even as we speak to the leadership at NHIF. Is this new regulations on reimbursements, is it justified? What has come out of that particular meeting, and what does it mean for you seeking health services in private hospitals? This is one of our top stories tonight. Good evening. Thank you for joining us here on KTN Prime. I am Akisa Wandera. Our sign language interpreter is Miresha Witi. Another stories making headlines tonight.
Kidney patients are many. So if they say they do that, it will be, they'll be sending us to our early grave.
Tonight, a major contractual standoff between NHIF and private hospitals threatens delivery of health services to patients. Football fraternity mourns the death of Isaac Juma, Kenya's football fan #1, who was murdered last night. Also tonight, President Uhuru Kenyatta signs into law controversial political parties amendment bill barely 24 hours after the Senate approved it.
Ninawasihi tafadhali mandugu zangu, tuchunge juu chini, tuchunge Kalonzo tafadhali.
Oka is stronger than ever before. Watu wa Nairobi mwambiwe hivyo.
And remaining Oka principals embark on a 3-day tour of Ukambani region in a bid to consolidate its support base. Welcome to the broadcast. Glad you could join us tonight. Nearly a month after passage of the NHIF bill, tough times lie ahead for private health providers following a contractual standoff between the national insurer and private hospitals. The private hospitals and NHIF have been holed up in negotiations for the better part of the day, following private hospitals' protests over new reimbursement structures by NHIF, which they argue offers rates not feasible for them. As a result, they say they will not offer services to NHIF members starting February 1st, that is Tuesday next week. Gloria Milimu opens up our bulletin tonight with that report.
The row pitting the government and private hospitals over National Hospital Insurance Fund compensation rates could limit healthcare access to thousands of people seeking health services from the private facilities, a number the Ministry of Health says is a minority of Kenyans.
From my approach, patients will gain. Why? What we are trying to say is 90% of the people of Kenya get services from the public health sector. NHIF has said there are only two contracts. You are either on a comprehensive or not in a comprehensive program. So these facilities that we are talking about that are not comprehensive, but because if you are not on comprehensive, you can be able to offer services and charge patients over and above what, and the people go there, no, and they have the financial wherewithal to pay. When you get comprehensive and you are small private facility deep in a county, the issue of comprehensive, then the margins that NHIF, because these figures have been arrived at a thorough scientific process.
According to private hospitals, the amount NHIF is willing to reimburse them for services rendered to its members is not feasible.
This structure, which has been in place for the last 3 years, slightly over 3 years, and if you do a line-by-line comparison of that previous structure and the current one, the rates have gone down, and especially for the surgical packages as much as 50%. So that cannot be justified on the basis that you, especially 3 years later, you can't have the charges having gone down.
Dr. Olweng says doctors will be forced to turn patients away come 1st of February if the issue is not resolved. For patients like Mwanahawa Kasandi, clearly this is a moment of loss. Mwanahawa has been on dialysis since 2019.
Serikali cannot accommodate all of us. They need to do their statistics first. We are many kidney patients are many. So if they say they do that, it will be, they will be sending us to our early graves.
Apart from public facilities, NHIF contracts both private and faith-based facilities to provide services to its members. Dialysis reimbursement has been 19,000 shillings per week for 2 sessions, but under the new contract, this same amount should cover 3 sessions extended to 3 per week.
Even if, for example, the public sector was able to provide the service, they don't have the capacity to overnight be able to accommodate all the patients that they were taking care of in terms of dialysis before, plus the new crop who are going to come in from the private and faith-based hospitals, for example. So this is precipitating a crisis which I deem as not necessary. This is something that could have been sorted out with sufficient negotiation and administrative action.
If this happens from 1st of February as per the private hospital stake, then most patients will be forced to pay out of pocket for health services in private facilities or contend with public facilities due to this disruption. The Ministry of Health assures Kenyans that the number of public health facilities outnumbers private facilities, and it anticipates no crisis in terms of access to health services.
We are talking about 1,500 private facilities in the NHIF, vis-a-vis over 10,000 public facilities. So what we are doing and what NHIF is trying to do is to shift the balance.
As to whether private health facilities will make good their threat from next week, it is a matter of wait and see. Gloria Milemo, KTN News.
Well, of course, that story has sent a lot of jitters across the country, not just for the private hospitals providers or healthcare providers, but also Kenyans at large. I want to bring in now the NHIF CEO, Dr. Peter Kamunyo, to just give us more details about this. Thank you very much for joining us tonight here on KTN Prime. We understand that NHIF and the private healthcare providers have been holed up in meetings for the better part of the day. What have we reached? Any resolutions? What did we converse in this meeting? Dr. Kamunyo, I hope you can hear me.
Yes, I can hear you, and thank you very much for having me on the show. the process of contracting that NHIF has been going through, every 3 years we renew our contracts, and right now we're in the process of renewing for the 2021-2024 contract cycle. And as you know, NHIF is a national health insurer, and recently upon assentment of the NHIF Act Amendment, the President assented to it on the 10th of January, and which was published on the 14th of January 2022, and NHIF became the National Health Insurance Fund. And this demonstrates the reforms that we have been going through to ensure that we are able to uphold, first of all, the Constitution, Article 34, 1A and 2, and also part of the Big Four agenda of His Excellency, the President, that ensures that every Kenyan has access to quality healthcare that they need without suffering financial hardship. And NHIF has been undergoing transformation to ensure that we get to this point.
Okay.
And this part of these reforms, which included the legislative environment to make sure we have a legislative platform that we can able to scale up for every Kenyan to have access, and also included addressing the issues of the benefit package, because we have been adapting our benefits to ensure that we address the needs of all Kenyans. And then the overall also reforms is to ensure we become a strategic purchaser of healthcare services to ensure that NHIF is also sustainable as we scale up towards getting to universal health
Dr.
coverage.
Kamunyo, so did we, apologies for cutting you short, so did we reach some sort of agreement with the private sector health providers today in the meetings? Anything you can tell us on that meeting?
We have been having several meetings regarding during the public participation to ensure that the providers, because our healthcare providers are the ones who deliver the promise that we have. On our panel, we have of the 7,666 providers that we have at the moment, slightly more than 70% are public facilities. That's about 5,000 plus. And we have about 24% that comprises of private facilities and faith-based facilities. And they provide these services based on reimbursements that we have been having over the years. At this point in time, we've actually been addressing the issue of ensuring that there is fair reimbursement to all providers. And one of the key reforms that we have done is we've made sure that we are also standardizing the reimbursement across all what we call the KEF levels, the different levels of hospital categories as per the Kenya Medical and Dental Practitioners Council.
Okay.
And the aim of this is to ensure that there's equity across and not favoring one side or the other.
All right.
And some of the key reforms and adjustments that we've done is to also do what we call a risk adjustment. As you know, the non-communicable diseases are on the rise, and the patients tend to go to the hospitals, especially from level 4, going upwards. So for this, like for the capitation, the outpatient visits, we have increased the capitation amount. We've also increased the rebates, bed rebates, per hospitalization day for all the hospitals across. And then as we were also looking at rationalizing our benefits packages, we have been involving them, and this is an ongoing event because we know the cost of healthcare is not static. It's affected by many things. It's affected by many things, including inflation, and you know, like medical inflation is about 2 to 3 points above what the national inflation
Okay,
rate.
Dr. Kamunyo, the biggest concern right now is on those patients with chronic illnesses, and that threat by private hospitals is quite worrying. What does it mean for them?
Our provider panel does not favor any side. We operate on principles of equity. And right now, as we have had the act assented to by His Excellency the President, we are in the process because there are certain items within, there are components within, which have also included certain prescribed benefits that are meant to further improve not only the experience, but also the coverage of our members. So right now, we are actually looking at extending the period to ensure that we incorporate the regulations following the enactment of the NHIF Act Amendment to ensure that we are able to address that. So within this process as well, as we do the public participation on the regulations, we are going to continue with further discussions to make sure that we have a win-win situation for every stakeholder.
Kamunyo, my last, sorry about that. My last question to you, my apologies for that. My last question to you, are we staring at a crisis? What happens if the private hospitals make good their threat?
No, I do not think we are staring at a crisis, and we should never approach this as a crisis management, because we are in partnership with the service providers. At least for now, because of the enactment of the bill, we have an opportunity to engage in further discourse as we do the public participation on the regulations, which are also going to affect the way we are contracting. And just to mention but a few, by the fact that the name of NHIF has changed from National Hospital to National Health Insurance Fund, it means that now we'll also be able to contract not only hospitals, but other healthcare providers, including laboratories, pharmacies, specialists, etc. So this has created an opportunity to be able to engage better to ensure that as we scale up for UHC, where every Kenyan has access, that we're able to address their needs. And this, we are always open to dialogue. We are always open to negotiating, because NHIF does not own any facilities. It is our partners who are the healthcare providers who provide the service and deliver on that promise that we have, that every Kenyan will have access to the healthcare they need without suffering financial hardship.
Thank you very much for speaking to us. It's a conversation we'll keep having. That is Dr. Peter Kamunyo, the CEO of NHIF, just joining us, trying to explain the rationale behind the reimbursements that private sector or the private health providers are not very happy about. What happens? He says we're not staring at a crisis, so wait and see the next action that the private healthcare providers will take. To a sad story now, and Kenya's football #1 fan, Isaac Juma, is dead. Juma, known for his antics on the pitch during football matches, was killed last night at his Mumias home by unknown people. Villagers are linking his killing to a land dispute involving his 6-acre land. Now, police say 2 people have been arrested in connection with the killing, and as Willie Lusige now reports, top leaders including President Uhuru Kenyatta, Deputy President William Ruto, and Raila Odinga are among Kenyans who have mourned the demise of Isaac Juma.
A somber mood engulfed veteran AFC Leopard fan Isaac Juma's home in Ebuyenjera village, Mumias West constituency, Kakamega County. The popular football fan, aged 56, was killed around 9 p.m. Wednesday night by unknown people as he went out of the house to check on his livestock after hearing a commotion.
Baada ya kukula kumaliza, yeye akatoka nje kusikia kondoo ikilia.
The deceased is said to have come face to face with his attackers who were wielding machetes. They vanished into the darkness shortly after the attack.
Akamua, akamkatakata hapo, wakakimbia wakaenda.
Kusikia FC Leopard ameuliwa, amewawa kinyama, nimefika kwa boma yake, nimehakikisha nimeona damu mahali wamemchinjia kama ng'ombe.
His family suspect that the murder of Juma was linked to a land dispute he was involved in. The deceased is said to have reported to the police that his life was in danger.
Juma alijaribu, akapigwa, akaenda kuripoti mpaka Lukongo, mpaka wapi, mpaka Mumias. Lakini walishikwa, na katika hilo kutoka ili wapatie ujeuri.
Maneno ya shamba ndio mimi najua, ameshawahi kuniambia tukua Nakuru, kama amekuja kutoka hapa akasema naenda Nairobi, kuona mpira na amepitia Nakuru kunisalimia ni kumpaka rangi.
But when no action was taken, the football fan opted to use a placard with words, "My life is in danger," which he used to display during major soccer matches.
Juma alikuja na mabango katika uwanja wa Mumias, uwanja wa Bukungu, akisema kwamba my life in danger. Akasema kuna watu wanataka kumnyang'anya shamba lake, na niko na uhakika hii ndio imeua Juma. DCI Kenya, mimi nilipost hii maneno all over the social media. Hakuna hatua walichukua.
Following his sudden death, top leaders including President Uhuru Kenyatta, Deputy President William Ruto, and ANC leader Musalia Mudavadi have sent messages of condolences to the family, relatives, and friends of the late Juma.
Sisi kama mashabiki, na naongea kwa niaba ya mashabiki wa mpira nchini Kenya, hakikisha kwamba those perpetrators ambao wamefanya hivi wanashikwa na haki inapatikana.
His wife also claiming her life is in danger.
Tunataka tumsaidie toka serikali. Watoto wangu hata vile mimi nazika tu Juma hapa. Nikikaa hapa niko na hakika mbele ya Mwenyezi Mungu nitauawa. Wanaona mimi ndio nimesimama na baba yangu. Mimi nimejua pia mimi penye wako wanatafuta mimi ndio watakuja kunichukua pia mimi wanichinje.
56-year-old Juma grew up in the remote village of Ebuyenjere in Mumias West Sub-County, having lost his father at the tender age of 2. Later, he worked as a newspaper vendor in Nakuru. People who know him say football was in his DNA right from his childhood. The veteran Harambee Star fan traversed the world to support Harambee Star, but lived poor life in the village.
Nimeshangaa sana at FC amesha report ata maisha yake hatari na hakuna mtu yoyote ambaye ameshashughulika. Nashindwa hapa Kenya ama area nyanakaa kuna serikali.
Willy Lusige, KTN News, Ebuyenjere village in Mumias West constituency in the county of Kakamega.
Right, and we continue to follow up on that story and, of course, hoping that justice will be served to that family. Now, President Uhuru Kenyatta has finally assented into law the controversial Political Parties Amendment Bill 2021, thus effecting it. The bill that saw legislators divided into those backing the handshake and those opposing it now introduces the concept of coalition political parties, outlining functions of political parties, as well as changing the criteria of accessing the political parties fund. But as our senior political affairs reporter Chris Tairu tells us, the opponents of the act have already threatened to challenge it in court on grounds that there was no proper public participation.
After heated debate characterized by miscaps in the National Assembly as well as divisions in the Senate, President Uhuru Kenyatta swung into action, assenting into law the Political Parties Amendment Bill 2021, barely 24 hours after the Senate approved it without amendments. Speakers from both houses were present at State House Nairobi to witness the signing of the bill into law. The bill will mainly come into play ahead of the August 9 general election. The law now gives a coalition political party some leeway in terms of registration process. It provides that the Registrar of Political Parties shall issue the coalition political party with a certificate of full registration upon receiving an agreement from the political parties 3 months to an election. This means that if the Azimio La Umoja would like to deposit their agreement with the registrar, then they have until April this year to actualize their plan. The Act also gives leeway to the proponents of Azimio La Umoja to field candidates in all elective positions, including that of the President.
Unlike the past, it's very difficult now to make promises pre-election. So any person who wants to make a promise, like the promises that have been made in the previous coalitions, the trust deficit is too high.
The politics aside, everybody needs a proper law on coalition making, because at the end of the day, no party can outrightly win election in Kenya without a coalition. I think that ended with the Kanu era.
The Act also ensures that the distribution of political parties' fund is divided equitably among political parties that managed to get elected representatives. Initially, a political party was eligible to receive zero funding if it does not secure at least 5% of the total number of votes in the preceding general election. The only two parties that met the threshold were Jubilee and ODM. The new law also allows the establishment of the political party's management information system, which shall be used by the registrar for processing political parties' records. The act allows the establishment of structures that political parties will use during their nominations. However, the opponents of the act have still vowed to move to court and challenge it.
The judiciary does not live actually in Ethiopia while they live in this country. So there's also the national interest, and I think part of the judicial mechanism is what constitutes what will add to the well-being of the people of Kenya. This bill adds to the well-being of the people of Kenya by injecting sanity, by injecting trust.
Will as many as of that opinion say aye?
Legislators affiliated to Azimio la Umoja movement used their numbers in parliament to pass their amendments and reject those proposed by legislators affiliated to Deputy President William Ruto. The Senate passed the bill without any amendments. Political parties are now free to strategize politically using the new act in readiness for August 9th polls. Chris Dairu, KTN News.
All right, let's now take a fast commercial break. You're watching KTN Prime. When we get back, we take a look at the politics of the day. Stay with us.
Unaweza jishindia boost ya up to 100% kwa possible win yako ya multibet yoyote. Kucheza ni 10 bob tu. Sport Pesa, made of winners.
Does 36 hours mean to you? With the construction of a new railway line linking the Standard Gauge Railway to the Meter Gauge Railway at the Naivasha Inland Container Depot, 36 hours now means the total transit time for transportation of cargo between the port of Mombasa and Malaba through rail. This is a game changer for transporters and importers, as they shall enjoy faster transit times at affordable rates from $860 for a 20-feet container. More benefits from the seamless railway line include reliable, regular and speedy delivery of cargo, safety and security of cargo through real-time cargo tracking, terminal incentives at the Naivasha ICD. With railway transport aiming to boost movement of goods in the East African region, improving hinterland connectivity and spurring regional economic growth, it is safe to say we are right on track.
University will hold Professor Justice Willie Mutunga's inaugural lecture on Friday, 28 January 2022 from 9:30 a.m. at the University Auditorium main campus. The topic will be In Defense of Radical Legal Education, a personal footnote. This event will be live on KTN News and streamed live on Facebook, YouTube, LinkedIn, Instagram, and Twitter. Kabarak University. Education in Biblical Perspective. A 50 by 100 plot of land for only 399,000 Kenya shillings. What's more, leap up 350k and get an instant shopping voucher worth 10k. Call us on 0790 300 300 or visit our website www.optiven.co.ke. Data privacy is commemorated every year on the 28th of January in an effort to create awareness about the importance of respecting privacy, safeguarding data, and enabling trust. The Office of Data Protection Commissioner was established to create a framework to protect personal data so as to foster confidence among stakeholders for enhanced service delivery. The Data Protection Act 2019 provides a framework for the right to privacy as it applies to personal data, practices, safeguards, rules, transparency and responsibility, safe collection, processing and storage of data. The regulation of processing personal data is done to protect the privacy of individuals and to provide data subjects with rights and remedies to protect their personal data from processing that is not in accordance with the Act.
Watching KTN Prime, thank you for staying with us. On to politics now, and One Kenya Alliance principals are going strong despite Sunday's defection of former co-principals Musalia Mudavadi and Moses Wetangula to DP William Ruto's camp. The principals, Wiper leader Kalonzo Musyoka, KANU chairman Gideon Moi, kicked off their Ukambani three-day tour, taking a swipe at the two former allies, accusing them of double standards, even as they called on Kitui residents to support the coalition, saying the government, if elected, would weed out corruption. KTN political affairs reporter Daniel Karaoke is in Kitui and filed the following report.
They say charity begins at home. And Kalonzo Musyoka, the Wiper leader, decided to follow this proverb by kick-starting his state house journey back in his backyard, arriving in Kitui County in style. Flanked by KANU chair Gideon Moi, Cyrus Jirongo, presidential hopeful Jimmy Wanjigi, and a section of Ukambani leaders to drum up support for the coalition. It is in Kitui County that the Oka principals castigated their former allies in Oka over their move to support DP Ruto during the ANC delegates meetings.
Tukaenda tukaona vile vitu vimepangwa. Hiki kiti tukaambiwa ni cha Ruto, hiki ni chako Kalonzo, hiki ni cha Gideon, na jamaa hawajafika. We were in Oka. Kumbe watu wamepanga usiku ama sijui 1 month before. Mimi niliketi nikaangalia ndugu Gideon, nikaangalia mbinguni. I said a moment's prayer. Then I told Gideon, twende.
Nyumba ya Oka tutakaa na tutasema naga vile tutakaa. Umefahamu? Tuzichezewe bwana. Tuzichezewe na tutakubali.
Wale waliotoroka Oka ni waoga, ama sio? Wale wamebaki huko ndani, wanaume hawa wakubwa na sisi wanawake, sisi ndio wenyewe.
The two have been accused of corruption, even as DP's wing found themselves on the receiving end of a massive corruption in the country.
Wewe utaenda umekaa na mfisadi mwenzako, unaanza kusomea Wakenya mambo kuhusu ufisadi. Hiyo ni aibu. Na mimi nataka tufanye siasa ya ukweli.
Wengine ukichoka unasema nimechoka ninaenda, uko na haki yako. Si ndio? Upange yako, tutapanga yetu, wananchi ndio wataamua. Iko wengine ambao unajua ufisadi na ni kama kidole na pete. Sina wajua,
Mungu si azumani. Ametuondolea wafisadi ama waweka pamoja waende.
The alliance have vowed to solidify their support across the country.
Ningependa nieleze ndugu yangu Jimmy Wanjigi. Nimesikia vile Kalonzo alisema 2013 ulimletea Raila. 2017 ukamletea Raila. 2022 mimi naomba uzimletee Ruto.
Tumempatia kila kitu. Hata nyinyi mumpatia kura mara mbili, si ndio? Kikapu moja, si ndio? Asante yake imekuwa nini? Asante yake imekuwa nini?
We are not going to join Azimio.
Na Kaluki, kama unataka uongozi tafadhali, this is the next leadership of this country.
Sisi tutaenda kusema huko kwetu, Kalonzo Musyoka ni muungwana. Kama vile kijana wetu wa Moi pia ni muungwana. Wangwana wawili wakishikana, Kenya iko mahali pazuri.
Ati kuna farasi wawili, sijui farasi moja hapa na mwingine pale, waambiwe sasa Buffalo Soldier amekuja na tutasonga mpaka mwisho.
One Kenya Alliance campaigns moves to Makueni County Friday as they seek to solidify their support ahead of the much anticipated 2022 general election. Daniel Kariuki, KTN News in Kitui County.
All right, and still in politics, after walking out on Musalia Mudavadi, Wiper leader Kalonzo Musyoka is now keeping the country guessing on what his next move will be. Will he soldier on with his presidential bid? Will he join Raila Odinga in the Azimio la Umoja movement? Most importantly, the big question is, what numbers does he command? Duncan Haemba puts into perspective the various permutations of the Kalonzo Musyoka factor.
Wiper leader and former Vice President Kalonzo Musyoka is now the man to watch, whose steps in the next few days will be closely monitored by political stakeholders, with the big question being which way Kalonzo will be wiping politically. Kalonzo, who is Kenya's oldest politician in the political arena, having been elected to parliament for the